welcome to another episode of Rehab Now, brought to you by the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. We have with us consultant physiatrist Dr. Paula Dawson. Hello, Doc.
Hello, Alicia. Hello, listeners.
Yes. And I'm your host, Alicia Taylor. Remember to check our social media pages. Rehab Institute Caribbean, Dr. Paula Dawson, Alicia Taylor Music, that's for Instagram. For Facebook, it's the Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com. Yeah. So this week we're talking about a few things, or two things. Scapular dyskinesia. Is it dyskinesia or is it dyskinesia?
You know, you could actually say both.
Well, that will mean not bad.
You're very good, actually.
Scapular dyskinesia and rotator cuff syndrome.
I get the sense that if you're a university professor, you can say scapular dyskinesia.
Thank you, Doc. Okay, so the two things, I don't know where we're gonna start, but I feel like we can start with the rotator cuff syndrome because it's kind of like picking back off of the shoulder arthritis thing.
So.
So let's talk about the rotator cuff syndrome.
Right. So I'm sure a lot of people have heard about rotator cuff syndrome. What is a rotator cuff? It's really a cuff of muscles that keep
rotating. Sorry, I had to do it.
Actually, that's pretty good. That's actually quite good because those muscles, there are 4 of them, right?
Yeah.
Supraspinatus.
Okay.
At the top, just above the shoulder blade, and at the back, and then you have infraspinatus. Mm-hmm. You know, I said them subscapularis, and you can say teres minor.
Teres minor.
Right. And those are the 4 muscles of the rotator cuff. And essentially, the arm is held onto the body by those 4 muscles, and the long head of the biceps plays a part as well. But if you notice, your knee is a hinged joint, right? And so it just hinged, just like the door, it goes in one direction.
Okay.
Right? The hip is a ball and socket joint, right? Which is why when you can dance, you can kick your leg around, so it goes around in a ball. You can't do that with your knee normally. Right. And then the shoulder joint now, it's really, in fact, the shoulder is like you know what a T is in golf?
No, I do not.
So when you're just about to hit the golf ball, they call it tee off.
Okay.
And so you have the little golf ball, and then you have a little wooden or plastic thing that is sticking to the ground with a little round top, and then the ball sits on it. So the ball doesn't sit on the grass.
It sits on the thing.
It sits on the tee. And so just before you hit it, you know, that's teeing off. Essentially, that is the proportion of the shoulder joint. So the part of the scapula that's articulating with the big round head of the humerus is like the golf ball. And the wonderful thing about that is that allows the shoulder for you to go all the way around, unlike the hip, right? So the hip is a ball and socket, so you can only go a certain way with the hip. With the shoulder, you can go literally every direction. And that mobility requires stability. Now, how do you get stability? You get them through the muscles, which is why the rotator cuff muscles are so important. So the rotator cuff muscles will hold the shoulder in alignment. Now, the rotator cuff muscles, they all originate on the scapula, and they insert on the arm bone, just under the acromion. You remember the AC joint that we talked about last week? Last time?
AC joint, right. That's it.
And so, just as those tendons go under the acromion, they can get impinged. Impinge means them can get pinched. And then they get tendonitis. Remember that word, tendonitis?
Jesus, of course.
Like arthritis.
Man.
Right, and so that is what rotator cuff syndrome is. It's inflammation of one of or all of the rotator cuff muscles. Supraspinatus, infraspinatus, subscapularis, or teres minor.
So what does a person feel when they have rotator cuff syndrome?
Right. So rotator cuff syndrome, pain when you do overhead activities, when you go to reach overhead and you get a sharp, like a pull, or when you're trying to reach across your body or go sideways, or especially when you go to button the bra, kind of pretty much similar to shoulder arthritis, or when you sleep on that side. But instead of it being a bony problem, which is with shoulder arthritis is a degenerative change in the joint, this is, when you do the x-ray, the joint is intact.
Oh.
Right, so there's nothing wrong with the cartilage and there's nothing wrong with the movement. It's really that the muscles, the tendons that are going around, they're inflamed. So it's an inflammation.
Well, that not bad. That not sound terrible. That sound like
Not so bad.
arthritis.
No.
So you don't have swelling and... Oh, but inflammation is swelling, isn't it?
Inflammation can be swelling, but you know what? With the rotator cuff muscles, you can get rotator muscle tear. So supraspinatus can tear. Any one of the rotator cuff muscles, the tendon can tear. In fact, I've had some patients where it has torn and they can't do overhead activities. They can't lift their arm.
That's
right?
excruciating.
Right, and then I'm sure we have some listeners, who will know someone when they go to shake their hand, they'll do a little kind of funny wink with the shoulder because the muscle, the supraspinatus, which is one of the recruiting muscles, may have a partial tear or a complete tear. The good thing, though, is the body, God is so amazing when He made us. There's some redundancy. And so there's a big muscle called the deltoid. You know those basketball players? Basketball. Which basketball team is your team?
I really should say this on air.
Let's just say Seth Curry. And let's just leave it at that. I'm just saying that because I'm a son.
I'm Heat. Anyway, let's continue.
Seth Curry, congratulations, Warriors. Anyways, so they won the...
I have to give shout out to the basketball team.
I have to give shout out for my son is a Warriors fan. They like the Celtics though. But anyways, so where was I again? So the deltoids, basketball players. I love to watch basketball because I love to see their arms. I see the nice biceps and the nice triceps. So anyways, as we digress.
Yeah, so God is so good.
God is so amazing, right? And so the first 30 degrees and the last 30 degrees are from the deltoid muscle. And so the middle is the supraspinatus. So we have a drop arm test where if that muscle is torn, if you put the arm here, it just drops. Really? If you put the arm outside, it just drops because the muscle, the tendon is now right. So it's drop arm test. So the supraspinatus. So up here, the deltoid will hold it up, and at the bottom, the deltoids, which the deltoid will be working. And so the supraspinatus is that one in the middle. You're good, man. Yeah, man.
Yeah, man. Okay, great.
Yes. Right. Right. And so the sort of rotator cuff, we have a lot of people come in with rotator cuff injury, especially I told you about, women reaching backwards to get their handbags, people doing a lot of overhead activities.
So that's what caused the rotator cuff syndrome.
One of the many causes. Now, I'm glad you asked.
Thank you.
Because outside of the overuse for overhead activity, somebody who paints a lot or throwers, sports people that throw, I have a lot of patients that get it who are going to the gym and doing the pull down incorrectly. So when you do the pull down...
Better say that one for them.
Yes.
Say that one loudly. Go ahead.
Right. So pull down in the gym, when it's an overhead activity. Now, this brings me to scapular position, which is why we talk about scapular dyskinesia. Kinetics is movement. And so when the scapula is not in the right position, it causes the scapula, the shoulder blade, to be tilted anteriorly. When it's tilted anteriorly, you don't have that free position for the rotator tendons to glide. And so if you're doing something overhead, you will impinge, you literally tear. So scapular dyskinesia, there's several different causes and different types of dyskinesia, but scapular positioning is very important in maintaining the integrity of the rotator cuff muscles. Right? And so those people in the gym, be very careful. Pull down.
How do you pull down? How do you just...
So there are these equipment where you have the weights and you have the bar over your head and you're pulling down, or even if you have the dumbbells and you're pushing up. Right. So that kind of, once you're externally rotated at your shoulder, you're going to kind of bring the humeral head closer to the acromion, and then you can impinge if the shoulder blade is tilted forward too much.
So what is the correct thing to do? Or should they not do it?
So I like that you asked that, which brings me to scapular dyskinesia.
Nobody want to wait.
You don't want to wait?
Yeah. Till after the break. But all right, go ahead. Because since they're so connected.
We can just mention, so what we can do is mention scapular positioning. All right, so it's best when the scapula is back, right? Is back. So once you can start hunching the shoulder forward, you kind of curve it and bring the scapula anteriorly. So when the scapula is back, you don't have as much impingement. Now, what will hold the scapula back? Tell me.
I have no idea. Gravity? I'm kidding. I don't.
What moves the joints? Muscles and muscles.
Muscles, I should have said, I was thinking it in my mind. I was like, no, I don't want to fail this test.
No, there's no test. But
muscles,
girl,
okay.
you're good at this thing. Right. So the muscles, so you have a lot of periscapular, we call them. Peri meaning around.
Okay.
Scapular muscles, and those muscles will hold the shoulder blade in position. You have the ones in the middle, you call the rhomboids, and then you have the latissimus dorsi. You have quite a few of them around the shoulder blade. And all of those muscles will help in a biomechanical way to maintain the position of the scapula, right? You have some congenital, children are born sometimes where they injure a nerve, right? A nerve during delivery, the long thorax, which causes scapular dyskinesia, winging of the scapula. So the scapula can actually wing, where literally when you push your hand, both arms forward, the scapula kind of lifts off the back. I mean, I'm sure people, someone might be listening and they say, that happens to my child, so the shoulder blade just lifts off. And it just means that there's some abnormality in the muscles stabilizing the shoulder. And that will serratus anterior, latissimus dorsi, rhomboids, all of these muscles are the muscles that are around the shoulder that help to stabilize the scapula on the body. And so, when you have dyskinesia is when you have problems with movement of the scapula, which will cause abnormal positioning of the shoulder blade. Positioning is always important.
Okay. So with the rotator cuff syndrome.
Yes.
With arthritis, you said that it's like degenerative or it's like trauma or whatever. Can somebody be predisposed to rotator cuff syndrome, or it's just something that you develop?
Girl, you must have read the book.
Come on, talk to me.
So you actually have the we probably should talk about it after the break. We're going to talk about the acromion, the shape of the acromion. So everybody will have a different shape. The acromion is like a little hook. And so you have more curvy than others. And the more curvy is the more likely to impinge.
Interesting.
But then, of course, you can fix it with, a stabilizing exercise and that kind of stuff. But we'll talk about that one.
Oh, what's not that bad? All right, so stay with us. When we get back, we're going to talk a little bit more about the rotator cuff syndrome, and we're going to go in great detail with scapular dyskinesia. Stay with us.
Stay with us.
Welcome back to Rehab Now. If you're just joining us, we're talking about rotator cuff syndrome and scapular dyskinesia.
That's right.
What were we talking about before the break, Doc? You were saying something about
the different causes of scapular dyskinesia.
And let me tell you specifically, I asked you about rotator cuff syndrome.
Right.
Being predisposed to rotator cuff syndrome.
Right.
Is that even possible? And you were explaining.
Right. And so I was trying to explain to you the acromion, which is kind of a curvy part of the shoulder blade. So the shoulder blade is like a triangle, right? I'm sure you've seen it on somewhere on the internet. And then there's a little hook that connects to the clavicle. And that's the AC joint, as I mentioned before, the acromioclavicular joint. So the acromion can it depends on the angulation or how the acromion is shaped, because the tendons from the rotator cuff actually run under the acromion and then insert in the arm bone. And so, depending on the shape of your acromion, you can be predisposed to impingement. Impingement is just the almost like overuse, repetitive use, friction that occurs along the tendon, and then the tendons get inflamed. Now, even with that, if the shoulder blade is positioned properly, that can help to prevent rotator cuff. And so the shoulder blade, you have different movement of the shoulder blade. You have external rotation, it goes posterior tilt, anterior tilt. It can rotate so that it can actually wing out or wing in, right? And so there's
wing out and wing in.
So you actually have something called winging of the scapula, right? And so the shoulder blade is on your back, right? And so medial winging of the scapula is when the shoulder blade lifts. It almost looks like a bat. Literally, when you look at some people, you know, in anatomy books, when they press against the wall, the shoulder blade pops out. It just kind of sticks out.
Oh gosh, I think I've seen that.
You have seen that, right? Usually thin people,
yeah.
right? Right. And then you can have lateral winging, where when you're leaning on a wall to the side is when you get the winging laterally. So different muscles. So the serratus anterior will help to stabilize the medial aspect of the scapula to the body, and then the rhomboids will help the other side. And so
I always thought there was some scoliosis issue, and I see people show them, look kind of weird.
But that's an important thing that you just mentioned. Sometimes you can have more prominent, you can see as one shoulder blade more prominent than the next in someone with curvature of the spine. And that's only because with that, the orientation, the posture changes. And so one scapula might kind of go into the curve, because scoliosis is a curve. And then the other scapula might be winging out. And so you get that as well. And so, I mean, the shoulder is so amazing. So if you have someone with winging of the scapula, you can strengthen the rhomboids, you can strengthen all of the periscapular muscles. You say posture is such an important thing.
Yes, talk to us.
So poor posture can lead to weakening of muscles. What do I mean by that? So when we're born, we're straight up.
Yes, we are.
And then as we grow older, we kind of lean forward.
Gravity or pull.
But then everything else is pulling us forward. For example, the phone. Literally, because we're always here. Before, as kids, we used to be up, we're looking around, we're running outside, we're climbing the trees, so our chest was more open. So we're more close, or working space is smaller in terms of, just technology, etc. And so what will happen is the muscles in the front will get short and tight.
Do you get chest pains from that too?
You can actually get chest pain. Eventually, when you go to stretch, you can get trigger points in the muscles in the front. But then the muscles in the back are overworking because you're now like this, and that's not efficient, because the body has an amazing way of allowing the spine to have different curves in different angles. So in the neck, you have a lordosis. Remember I told you that the backward C, and then you go down to the thoracic spine, it's a real C, so you're kind of bent forward a little, not too much, because when you bend too much, that's kyphosis, hunchback. You don't want that. And then when you get down to the lumbar spine, you have a nice deep curve in this lumbar spine again. So the curve, that's efficient. That's the efficient way of distributing the weight along the vertebral spine, so you don't have too much pain in one aspect of the spine.
But it all just seems like so much to keep up with. Straighten your back or push this or just curve that. It so
seems
much.
Like a lot.
It is a lot of work.
It is a lot of work. But you know how to make it easy?
Tell me.
How to make it easy is to know what the proper posture is. And I'm sure most of us do know what the proper posture is, we just don't practice it. So whenever you find that you're not doing the proper posture, then that means that you're doing something that will cause weakness or tightness or pain at some point.
But I think also we go from one extreme to the next. When it's poor posture and we hunch.
Yes.
Some people, when they must straighten, them go all the way back, and that can't be good either.
And I like the fact that you said that, because just straightening up one time is not going to do it.
Yeah.
It won't do it. It won't be sustained.
Okay.
So you have to train the muscles to fire all the time. That should be your habit. And so you have to train the rhomboids, muscle memory, absolutely. And so it will take some time for the muscle to get stronger, for the rhomboids to be pulling backwards, for the periscapular, the multifidi, the paraspinal, sorry.
Here it is again. Go ahead.
Okay, the paraspinal muscles, those are the muscles going up and down the spine. If you were to put both hands at your back, both of your hands on your back, you feel that ridge on either side?
Yes.
Right. So that ridge goes all the way from by the shoulder blades all the way down. Those are the perispinal muscle. Paraspinal, and you have different layers. You have multifidi, you have iliocostalis, you have, you know how many of them there are?
1,200? Because the body is very complex.
Hey, can you imagine if somebody make a rap song about spinal muscle? That sounds like Spanish.
I'd be confused.
Yeah. But the
Everybody
good
would be
thing
confused.
is, though, you said it's confusing. Let us make it simple.
Thank you.
You have to know perfect posture, what a perfect posture is. And so you have to maintain your stability, which is why exercise is so important and posture is so important. Now, one of the things we spoke about in one of the episodes before is ergonomics.
Yeah.
Do you remember ergonomics?
I do.
And so a lot of people now, because they're always at their computer, they're at home, because of COVID, they're now working from home, and working from home, you're on your dining room table or in your bed or in your couch. That's not good. Those things will lead to your changing in your posture, and then that can lead to shoulder. Especially a lot of people are in the bed, on the computer, on the elbow.
That's me.
And the elbow, that pressure, your weight bearing through the elbow, you can pressure the rotator cuff muscles.
And then that people in the bed with enough kneeling down on you. Man, that's terrible.
Kneeling. You're not kneeling with your elbow.
Me kneel with my elbow. It's kneel me call it.
Right, but that is true because you pressure your elbow. And I want to tell you a story, you see my elbow, my left elbow is darker. My left
me
elbow.
have black elbows, period.
No, but my right elbow not so black because I lean on my left elbow all the time.
Oh, wow.
So it's leaning on your elbows. It's not because it's because of pressure.
This one darker than this one, I think.
Mine too, but I have one long sleeve.
I'm always
yeah,
this.
that's because exactly it's the pressure.
Yeah.
You didn't realize that?
I didn't know.
Yeah, man. So it's the pressure from leaning down. So guys, do not lean on your elbows.
Okay, so if you don't lean on the elbows, it won't get dark.
It will clear up. It will clear up.
You hear that, elbow?
With some buffing
Oh.
and some exfoliation, it will clear up.
Doc, I'm happy I came here today.
I'm happy you're here today.
Clean elbows. Sorry.
But we're not talking about elbow today.
We keep digressing. We're always doing this.
No, but you see, weight bearing through the elbow will lead to shoulder problem.
True.
So if
True.
once your
Everything's
elbow
connected to everything.
It is. And so once you're no longer leaning on your elbow, your shoulder pain should improve.
Thank you.
No, scapular dyskinesia.
Just gonna go there.
What you want to ask them about scapular dyskinesia?
I just want to know like some of the signs or the symptoms. How do I know I got scapular dyskinesia?
Well, so pain when you try to move your arm, you actually can hear popping and snapping.
Hey, when I hear popping and snapping.
Where? In the joint?
In any part. When I hear popping and snapping,
Yes.
I think, okay, maybe the muscles are stretching or something.
So
that's how it feels. That's how it sounds.
That's what it sounds.
Yeah.
But okay, so popping and snapping, we don't probably worry about it all the time.
Okay.
Why? Because if it comes without pain, for example, if you crack your knuckles or sometimes you bend your knee, you hear a pop. Sometimes it's just the ear. There you go. Sometimes it's just the ear, just popping through the joint. Right. But then you have another type of popping, which is crepitation, which can be painful, which is where you actually have grinding, which is causing the popping and snapping.
When you say pain, like on a scale of 1 to 10.
It can be anywhere from 2 to 5 or even more. But it's pain because just now when you cracked your knuckles, did it hurt?
No, not
exactly.
even a
So
little
that is normal, right? No, the popping and the snapping, you can actually hear like a kunk, like a kunk in your shoulder blade. So that is one thing that can give you the popping and the snapping. You can also have movement of fibrous tissue, like the fascia across each other. You can get the popping and snapping as well. And so you can get decreased range of motion, you can get pain, you can get a popping and snapping, you can get limitations in your movement. All right, and so these are some of the things that people with scapular dyskinesia complain about. The ones with rotator cuff, they come and tell you, I can't reach for anything in my cupboard overhead, or anytime I reach for something higher than at my horizontal level, it hurts. Or lift their arms above, like 30 degrees going sideways. Yeah. So that's because rotator cuff muscles are the ones that will mobilize the shoulder and they're inflamed. So scapular dyskinesia, abnormal movement of the scapula. You can have winging, middle winging, where the inside part of the scapula cock up, or lateral winging, where the outside part of the scapula cock up. Different muscles will be... different muscles will help to stabilize the shoulder blade. And so with scapular dyskinesia, in addition to the abnormal positioning of the rotator cuff, they also cause muscles to overwork. And when muscles overwork, they get painful. They get trigger points. Myofascial pain. So, I have, in my middle of my back, I have a knot right by my rhomboid. It's just my left side because I'm always leaning in the bed. And after a while, my shoulder blade hurt me because I've been pressing on my shoulder blade. So, essentially, good posture.
Okay.
Don't sit in the bed and do anything.
Okay. Good.
And listen back to our ergonomics episode, which is online on YouTube. Or we have a new YouTube channel now.
Yeah, look at we.
Rehab Caribbean. We're gonna post all the episodes.
You guys should see the episodes more than you hear them. They're hilarious. But anyway, quickly.
She's hilarious.
No, you're hilarious. So the time is coming up. So what about treatment?
Oh yes, of course, treatment. Okay, so the first thing, if someone has pain, you want to control the pain. You can't start doing any therapy before you have good pain control. So you can have something. You can start with topical, believe it or not. You can start with
yes, that's good. Yes.
something rub on.
All right.
Ointment. Your grandmother always ninth. It's ninth or anoint?
Ninth, but we say ninth. We love ninth in Jamaica, we love it.
Right. Diclofenac brand. Not diclofenac brand. Diclofenac is generic. You can use that. Very good. A lot of people have arthritis thing as well. The rub, you can use that. But then after the topical, then you have things that you can take by mouth, anti-inflammatory. A lot of times, I have to give the patient muscle relaxant because the muscles are over.
Yes.
Firing.
Okay.
Right. I actually do a lot of injections in the periscapular muscles. Patients love it. They come in. It's like, I have so much pain. I can't move my neck. I can't move my shoulder. And I inject them.
And the injection
rotator cuff.
clears it up.
Yeah, man. I inject rotator cuff muscles.
Can you replace? I'm so sorry. Can you replace your? Like way you can have a.
Remember the last episode we say you can replace the shoulder blade? You can replace the shoulder, not the blade, the shoulder joint.
Yes, the shoulder joint. Okay, great. I know that, but I was just talking about the scapular dyskinesia thing. Okay.
Like some of the injections that we do for the shoulder. I had a surgeon once was about to go in operating theater and he couldn't move his arms. Literally, I got some betadine and some steroid, lidocaine, and inject him, and he did his surgery, and he never had any problems after that.
Clear it up.
Yeah, clear it up. But then the good thing is he was good because he did his therapy.
All right. Rehabilitation Institute of the Caribbean.
Yes.
That's all the time we got here. Thank you so much for joining us. Big ups to Power 106 and all of our studio engineers and producers. Thank you very much to our sponsors. Rehabilitation Institute of the Caribbean, providing medical care for function and performance in association with Winchester MRI, Jamaica's first choice for MR imaging, immune active dank, a combination of key active ingredients designed to boost the body's natural defense, and Almighty Studios.
Almighty Studios,
a recording studio, right? Where we create worship music to praise, to worship, and to serve. That's all we got time for. Thank you. Love you. Blessings. Bye-bye.
Bye.